Hi, I'm Mike from the Mayfair Clinic, and in this video I'm going to talk about some of the big mistakes that patients make when it comes to doing exercises or stretches for their back pain and what you can do about it. A lot of the time patients are coming in doing the wrong stretches. They're doing things like knee hugs, they're doing things like hamstring stretches by bending forwards. They're ineffective and they're actually making the cause of their back pain worse. And what's more worrying is that they're doing this sometimes for many years before they even get to come and see someone like us who tells them the right things to do. And thankfully, because we've got some great technology here, some great equipment that you can read about on our website, they get better. But it'd be so much better if they just stopped doing those wrong things and did the right things. And research shows that if you're doing the right sort of exercises, the right ones, core activation exercises, in as little as 3 months, you can reduce your back pain by 77%. That's at home. It is so effective and so easy to do, especially for more simple causes of back pain, that there's really no excuse to not do it. Now, in the clinic, we use a great app that allows our patients to do their rehab at home. We have videos, explanations, tips, things to do, things not to do, to basically make sure that that patient can be guided through those exercises in the most effective way whilst avoiding all the pitfalls. That's exercises to effectively engage your core to start off with, because if you can't do that effectively, then you're not going to be able to do the more advanced exercises. It's combining a good proportion of strengthening and core activation, as well as some simplistic and targeted and safe stretches to really complement that process. So you're tightening and strengthening up certain muscles while keeping other muscles, particularly the lower limb muscles down here, nice and flexible, nice and free, so extra stress isn't being put on your back on a daily basis. And we've started to allow patients outside the clinic, or people like you watching this video, to use the app, to download it, to start our Back in Shape program and work out from the comfort of your own home, taking you through a series of steps over the course of the weeks and months to take you from being in a position of having discomfort in the back or a problem that's not going away, going through the right simple exercises and stretches to start with all the tips and videos of myself or Joe or the other guys here going through those exercises with you, holding your hand to make sure you're doing the right things, and then advancing those exercises to make sure that you get progression, which is another of the big mistakes a lot of patients come in to the clinic complaining of. They've been doing some core exercises. Maybe they did a 15-second plank and they've been doing that for the last 6 months and wondered why they're not getting any stronger. So it's important that the program that you're doing is actually progressive. It allows you to get stronger over a course of time, but not too quickly, not pushing it too quickly so as you re-injure your back. And also doing those stretches, playing a key role in making sure that as you start doing more compound exercises to really enhance that strength and protective function of those muscles for the lower back pain, that you don't start to tighten up as a result of neglecting some more simplistic stretches along the way. So if you want to learn more about the Back in Shape program and how it can help you and how you can get involved, it's super easy. Just click the link somewhere on this page. And also, we've also included a link to that research I mentioned in terms of the 77% reduction in back pain. It's independent, not our research. We'll put a link to that in the description here as well. But if you want to start the Back in Shape program, then click the link to learn more about it on the next page, and you'll go through a bit more of an explanation on what it is, how it can help you, what you can expect from it, and why you should get involved today.